Good morning, good afternoon. Welcome to the Family Drug Court Learning Academy webinar series. This webinar series is hosted and supported by the Office of Juvenile Justice and Delinquency Prevention. We appreciate all of your attendance this morning. My name is Phil Brighton-Busher. I am the Project Director for the National Family Drug Court Technical Assistance and Training Program. Today you're going to hear about another initiative in which I'm the Project Director for, which is the Prevention and Family Recovery Program. Before I get started, we shared with you, if you were logged in, you were seeing some resource slides, and we just became aware of another resource that we'll be sending out some information on, but we thought timing is kind of critical on this one. I thought maybe if you were listening from a rural community, you might be interested in this, that there are scholarships available through the Bureau of Justice Assistance, both for registration and $500 towards your travel to the 2015 National Rural Institute on Alcohol and Drug Abuse. We'll be hosting a family drug court track during this conference, and so if you're interested in those scholarships, please email us. We'll be sending out information through our listserv, so if you get regular emails from us, you'll get that also. So I wanted to make that announcement before we get started. So again, thank you for your time today. We are really excited to bring you some early lessons from the Prevention and Family Recovery Program. You'll hear today from Dr. Nancy Young, our Executive Director here at Children and Family Futures. You'll hear from Rosemary Chalk, who is a consultant to child well-being programs at the Doris Duke Charitable Foundation. And you'll hear from Phil Redmond, Associate Director of Child Care at the Duke Endowment. Excuse me. So today's learning objectives are essentially we're going to discuss early learning lessons and progress associated with implementing and integrating these evidence-based parenting and children's services. We're going to explore some major factors associated with the Family Drug Court's readiness to implement these programs, and discuss some early lessons learned on this initiative and how you might be able to take these lessons and implement them in your own jurisdictions. As we go out throughout the presentation today, we really encourage your questions. And so there should be a question box on your panel, which is typically to the right of your screen. You can expand that and please type in your questions and we will try to respond to each of those questions. We also recognize that during the registration process, you submitted questions to us and we've done our best to incorporate answers to most of those questions in today's presentation. Of course, if we're not able to get to all of your questions during the presentation, we will try to get those after the presentation. So if you didn't hear your particular question answered, please again feel free to follow up with us either using your question box on the side or sending us an email. So starting with just kind of background a little bit on how we got to the Family Preservation or Prevention Recovery Program, we recognize that family drug courts have undergone an evolution over the past 15 years in which many of us in the early days really focused on parents' recovery in the family drug court context, in which we recognize that child welfare struggled to get parents early access into treatment and to monitor that treatment effectively in accordance with the Adoption Safe Family Act timelines. And so family drug courts really were a way to assess parents and to get them quick access and to monitor their progress. And as we evolved, many of us began to say, well, what's happening with the children of these parents? And so we began to really at least talk about children in our family drug courts. We began to look and to ensure that children had or were receiving assessments, and if they were getting assessments and needed services, we were trying to connect them to services. Where we've moved to now, especially with this project, is serving the full family in treatment, so family-centered programs with this Family and Prevention and Recovery Program. And we'll talk more about what that means in the context of this project. But as you hear kind of those levels of family-centeredness, we wanted to start off today's presentation with a polling question to you. How family-centered are you in your FDC? So we're going to open up this polling question now. We'll give you just a few seconds to respond to it, and then we'll begin the presentation. Okay, great. Thank you. So let's take a look at the results here. It looks like about a third of you are responding saying you're seeing the parent and child are receiving services. And a quarter of you feel that your court really is focused primarily on parent recovery as the primary focus. About 15% are uncertain, and about 20% or 18% or so say that parent is the focus, but children will receive services. So it looks pretty split with those top three. So a third of you, though, are really moving towards the deep end of these services and these connections. And I wonder how many of those third are actually PFR grantees. So if you are a PFR grantee, welcome, and we're glad you're here, too. With that, I'm going to turn this presentation over to Dr. Nancy Young.
Thank you very much, Phil. I'm very happy to be with everyone today and being able to share information about the PFR, as we call it, Prevention and Family Recovery. This is not unusual to have those kinds of responses that we just saw in the polling question about family-centeredness in family drug courts, particularly in light of the evolution that is going on within the treatment system itself. We recognize that the vast majority of states don't collect information in their data system about their parenting status of the individual coming into treatment, or collect information about children that are living with the parents that are coming into treatment. So we recognize that there's some distance to go to really being family focused in services, recognizing, I think, what many of us have said for a very long time, and you see the slogan, it's a family disease, and each of the members of the family have their own effects based on the individual who has a substance use disorder in the family, and yet recognizing what does that mean for prevention for the children, for intervention for the effects that they may have, as well as intervention for the other family members, is behind the times, I guess I would say, if I can be that bold, to say how do we look really comprehensively at family-centered approaches. What does that take in terms of collaboration to work across systems to address those needs of the whole family and the other service systems that serve children and have the expertise about their needs? How do we take what we know in that child-serving arena with evidence-based practice, particularly around parenting and child development and the conditions that children may have from either pre- or postnatal exposure to substance use in their family? How do we take what we know from those evidence-based practices and put them to play in a jurisdiction that tries to address all of these at once? And that, in fact, is what the PFR, Prevention and Family Recovery Initiative, is seeking to demonstrate. How do we do that? What are the lessons? How do we inform the larger field about these lessons? And how do we take that information forward for other jurisdictions that may be grappling with some of these same issues? So you see the project goals that were developed about expanding that service array, and as I mentioned, particularly related to the parenting services and the developmental and therapeutic services for children, with a focus on young children, the 0 to 8-year-olds primarily, although we recognize that certainly older children and adolescents also have effects from living in families with substance use disorders. But this particular initiative really focusing on those developmental milestones that are so critical in early childhood. How do family drug courts expand their capacity to sustain these more family-centered comprehensive services? Even though the jurisdictions may have had very effective collaborations when they were really focused on substance abuse treatment, child welfare, and the court system, as we'll talk about, each time you add a new partner, it's probably not additive, it's probably exponential in the terms of what the requirements are in communication and really being clear about what that added partner means to the larger collaborative. And so how do we look at both the practice area and the larger systems about those expansion of the collaborative partners as we're trying to support families? And then can we identify what those strategies are, the larger context of the community, how these systems work, how we might best document the conditions that support that implementation, as well as the barriers and how to address the barriers as these courts that we're working with strive to sustain the lessons and the implementation that they have conducted to make sure that they're really serving the family and paying attention to those child developmental and intervention needs. And then the task for all of us really in trying to make sure that we're disseminating this information to the larger field, that the effort that goes on in these particular sites informs other family drug courts and other jurisdictions that are seeking to address the substance use disorders in the child welfare population. And this is, in fact, one of those efforts to disseminate our early lessons to a larger group beyond those project partners that have been embarked on this for over a year now, with the sites about a year into implementation. So Children and Family Futures, we're based in Orange County, California, providing technical assistance and support to the grantees, as well as documenting the lessons, evaluating and disseminating those lessons. You will hear from Rosemary Chalk, who's been one of the key leaders in this effort from the Doris Charitable Foundation, who is providing the support to 3 of the grantees. And you'll hear from Phil Redmond, as was mentioned, from the Duke Endowment, based in North Carolina, with 1 grantee there, and he'll tell you a little bit more about the Duke Endowment's work. We also have been joined by a group that we refer to as the National Advisory Council, both providing input and guidance to us on implementing the strategies and the mission, fulfilling the mission of the Prevention and Family Recovery Program, and also providing individual consultation to specific grantees on implementation barriers and challenges that they may have. And then certainly as we move through the process of site selection to the 4 PFR grantees that we're working with. That site selection was not just send in an application. We tried to be very specific about the kinds of criteria that needed to be demonstrated, both with the basic family drug court operations, that the treatment access for parents was part of the collaborative and an active partner, that they either had current or had planned parenting services, as well as child development and therapeutic services for children. So they had embarked in some way on addressing the children's needs and recognizing the effects for the full family and the need to be family-focused in their interventions, as well as focused on trying to build their capacity for improving their systems to address the full range of the family challenges and needs. You see the sites that we're working with: Tompkins County, New York, with the Department of Social Services. That is, for those of you not in the New York or upper Northeast area, that is near Ithaca, or Ithaca is part of that Tompkins County. Robeson County, North Carolina. Pima County, Arizona, for those not in the Southwest, that is Tucson, and then San Francisco, California also. Each of the grantees really received some funds to designate what they needed to be able to get started and to implement services, as well as coordinate the lessons and documenting the lessons. So that's where we're at with those particular sites. This, however, is a chart that gives you a little bit of idea of what they are implementing, what they proposed in terms of the evidence-based parenting program or child intervention. I won't read through each of those. We'll take some time just so you can see the similarities as well as the differences across sites. about what they felt really would meet the needs of their particular families in terms of the specific programs to be implemented. Again, often these were the parenting and the child development interventions that were needed. As I mentioned, the substance abuse treatment needed to already be an active partner in their collaborative, and the funds that they received were not paying specifically for substance abuse treatment services. Those were already in the community and already supporting the Family Drug Court. So again, I won't go into more detail related to those, but we'd like to hear from you about what kinds of parent-child services are currently offered in your Family Drug Court. Jonathan, if you'd launch that poll, and please go ahead and check each of the boxes that apply to your particular jurisdiction, and give us some information. If it's another program that we haven't mentioned here, let us know what you're doing. We'd like to hear from you in terms of these kinds of interventions. Okay, thanks very much. Really nice to see those kinds of results, with 3/4 of you having implemented an evidence-based parenting program, parent-child therapy. Half of you have the connections to the child developmental or behavioral supports that are needed. More than half that have implemented trauma-focused therapy for adults and children. Very nice results to see, and to be honest, a little surprising for me to have that depth of information and that depth of experience within the sites that are participating with us today. All right, let's move on then. Let me reintroduce Rosemary Chalk, who is a consultant with the Child Wellbeing Program at the Doris Duke Charitable Foundation, to give us a little bit of background about the Duke Foundation and their support of this program. Rosemary?
Thank you, Nancy, and Phil, thanks to you too as well. I'm delighted to be part of the webinar today and look forward to the discussion. My role is simply to give you some general background as to why the Doris Duke Charitable Foundation initiated this project, and it might be useful to give you an overview of the foundation's profile as a beginning to that conversation. The Doris Duke Charitable Foundation is located in New York City, and the foundation has 4 priority program areas, which include support for the performing arts, environmental conservation, medical research, and the promotion of child well-being. The foundation also provides support for Ms. Duke's properties, which are located in Rhode Island, New Jersey, and Hawaii, to really sustain and improve their cultural and environmental heritage. The Child Wellbeing Program is really focused on trying to, it was actually reformulated several years ago from simply a prevention of abuse and neglect mission into one that's stressing the importance of supporting efforts that promote children's healthy development, especially those who are at risk of abuse or neglect. And I should emphasize that this approach and this placement of priority on prevention is really in line with the public health approach that was adopted in the Child Wellbeing Program to address child maltreatment through a public health strategy. It's important to note that during her own lifetime, Doris Duke supported over 80 child welfare organizations striving to offer assistance to troubled children, youth, and families. And you can go to the Foundation's website, which is noted here, to get more information and background about the overall program mission and strategy. Prior to making the grant to the Center for Children and Family Futures, the Foundation identified substance use as a key risk factor for child abuse and neglect. And we became aware of the important work that the center had already performed in offering training and technical assistance to a wide number of family drug courts, noting that this assistance was often supported through an array of federal grants. But we also recognized that many of these courts had a very uneven quality in terms of the types of parenting programs or developmental behavioral services for children that could be provided through the family drug courts. And so the time seemed ripe, therefore, for an effort that could build from the experience of several pioneering efforts, such as those developed by the Miami, Florida Child Wellbeing Court model, as well as the Safe Babies program that had been created by 0 to 3. And the grant to the center strove to bring these strands together through a series of collaborative discussions that were essentially integrated into the final proposal submitted by the center. You may be interested in knowing a little bit more about other grants supported by the Doris Duke Foundation. The 3 priority areas that guide the Foundation's grant making are listed here. One is to build a more robust repertoire of prevention strategies through place-based approaches, with a series of grants noted there. Secondly, to expand the capacity of existing service systems, especially those that operate in high-risk situations. And this second area includes the Prevention and Family Recovery Project that we're discussing today. And third, developing and disseminating knowledge in order to build a broader audience for child well-being. And further information about each of these grants, again, is available through the Foundation's website. Finally, I should note that the Prevention and Family Recovery Grant offers a unique opportunity to test the use of a diverse set of evidence-based parenting interventions within the 4 grantee courts. In an earlier slide, Nancy showed the wide array of programs that the courts are currently implementing. We think it's premature at this time to focus on only 1 or 2 programs and really want to use this grant as an opportunity to address the experience with multiple approaches. The grant also provides a very valuable opportunity to develop integrative and system-wide practices that put a strong emphasis on knowing more about the parent-child relationship, as well as child well-being indicators within the family drug courts, and to evaluate the challenges associated with such efforts. We anticipate that this project will encounter several obstacles, and some of those have already emerged even in the short initial period of the project. But we are keenly interested in knowing more about the lessons learned both by the project staff and the grantee courts in developing strategies to cope with those obstacles. So with those remarks, I'm now pleased to introduce Phil Redmond from the Duke Endowment in North Carolina.
Thank you, Rosemary, very much. And also let me say how honored I am to be participating in this webinar. This is an exciting project and look forward to the larger discussion that will occur shortly. Like Rosemary, let me give you just some brief remarks about the Duke Endowment itself and then share a little bit about why we consider this project such a vital one for North Carolina. The Duke Endowment is a private foundation headquartered in Charlotte, North Carolina. We're a regional funder, meaning that we fund in just North and South Carolina. We work in 4 areas: higher education, we also fund in healthcare. Uniquely, we fund rural United Methodist churches, and then most relevantly for today's discussion, we fund in child care. In child care, we target children who have been or who are at risk for abuse and neglect. We work in 2 areas, prevention and early intervention, as well as out-of-home care, which might more commonly be called the child welfare system. In both of those areas of work, our long-term outcome is to see improved child well-being. This is our theory of change for our prevention and early intervention area. You can see our primary strategy is to see the wider dissemination and replication as well as the proper implementation of evidence-based programs. Those programs can range from parenting models to very intensive clinical and mental health interventions. So in this case, we have a combination of a drug court whose efficacy has already been demonstrated by a number of outcome studies, coupled with evidence-based parenting programs as well as evidence-based clinical interventions. And we felt these factors together helped move us towards meeting and achieving our own desired goal of improved child well-being that results from our grant making. On the next slide, you'll see our theory of change for our out-of-home care or our child welfare work. Our primary strategy here is to support quality providers who provide a wide array of services that meet children and family where they are with what they need. So in this instance, you have a high-functioning quality drug court in North Carolina, partnering with substance abuse provider, parenting services provider, partnering with clinical interventions being provided as well. All these factors together, like our work in the prevention arena, convinced us that this project would help us move towards meeting our long-term goal of improved child well-being. So let me stop there and just say that we're very excited about the opportunity to participate in this grant. We're incredibly pleased that we had a high-functioning court in North Carolina that could participate in this project. And I look forward to the discussion that we're going to be able to entertain as part of this webinar. And like Rosemary, we're very interested in learning the lessons, both from the grantees and from staff, as well as perhaps from some of you as well from your own experiences, and being able to take what we've learned and improve well-being outcomes for kids and families across the Carolinas. So thank you. I think I'll turn it back over to Nancy now.
Great. Thank you very much, Phil, and thanks for sharing that perspective with us. So the next section of this webinar today is what we're referring to, as you can see, snapshots of the early lessons learned. The sites themselves have been in operation just about a year. We've had an opportunity just a couple months ago to have teams from each of the sites together, and it was, I have to say, one of the more exciting cross-team site visits or meetings that I've participated in. Lots of energy in sharing lessons and uncovering the barriers to implementing these programs, as well as some great solutions, and we want to share some of that with you today. The change team that we're talking about in terms of the staffing from Children and Family Futures includes one of our senior level program associates and a change leader associate. So we have a team of 2 that are working with each of the sites. The highly experienced in collaborative practice and the facilitation skills. We have a few people from our staff who are part of the evaluation team. Together there are monthly progress calls, quarterly site visits, some issue-specific technical assistance that I mentioned previously, particularly around some of the trauma work and the family-centered practice, and then the annual grantee meeting that I also just mentioned. We just had a lively discussion at recently. And then the National Advisory Council on the website that you'll have the link to lists the Advisory Council that are, we're pleased to have such depth of knowledge as well as the breadth of knowledge across child welfare and the courts, child development, parenting, family-centered substance abuse treatment, as well as some of those policy issues looking at sustainability and systems change. And again, as I mentioned, are doing both the advising to us in terms of how the program was structured and how we're implementing it, what the kinds of things we're looking for, as well as providing that site-specific technical assistance. We spend just a second to talk about the evaluation with an approach that says we need to understand the environment and the context of the systems change and the implementation of programs, that there are lots of different contexts in the community about the way in which the individual family drug courts are structured and how they're operating, the larger system connections and collaborative nature of the family drug court that we need to be able to understand. And we're doing that in a few different ways, using both some quantitative measures about families themselves, as well as the qualitative information that we're getting from the site visits, as well as the progress reports that the sites submit through us to the foundations. We recognize that collaboration has a strong need for effective leadership, and Phil Breitenbuscher will be talking about some of those early lessons in leadership at toward the end of our presentation time today. but we want to highlight that in recognizing that key of leadership and where it comes from in the particular family drug court site, what those aspects are in sustainability and moving forward are key lessons that we needed to explore. We also have asked sites to use some rapid cycle testing and feedback loops so that we're understanding what they're trying in solving some of the barriers and how do we help them understand those challenges and give them information back pretty quickly in that feedback loop. And doing that in a way that helps to build their local capacity for ongoing monitoring of their performance and monitoring their effectiveness over time. We're doing that with some key data components in those evaluation domains of family outcomes. You see the tools that are being used, including the annual data reports and the monthly reports that are being submitted to us, as well as the clinical tools with the North Carolina Family Assessment tool, as well as a Family Strength and Needs survey. The process improvement with some interviews with leadership, again, you see that common theme, and the other ways in which we're collecting qualitative information. And some focus that has been from the very beginning in understanding their collaboration and efforts to sustain their programs over time, and how the site selection surveys were completed and how we see changes in some of those aspects again over time. So this is our opportunity to share what have we learned and how do we think we're going forward with this. Even though the family drug courts had to demonstrate that they had effective systems in place for communication and effective collaboration, as I mentioned previously, each time you add a new partner, particularly if it's a partner you haven't worked with previously, the accomplishments of bringing in the other children's services providers, in some cases public health nurses, in some cases a broader array of substance abuse treatment providers, and addressing the trauma issues for parents in the mental health services. Great accomplishments, and we recognize very challenging kinds of collaborations that needed to be put in place. If we look at some of those highlights of what they've actually told us in sites, that this increased focus on the expanded access to evidence-based services, some of those quotes that we love to hear, in fact, one of the participants of the caseworker saying, I love to hear a parent say, I'm going to evidence-based parenting. That's not the typical that you would hear in a child welfare agency or in a dependency court, and so this shift to say that they recognize that there's something different that's going on in the parenting services is very important. Some of the things that we heard recently at the cross-site meeting, the ideas about how thinking about visitation, and we recognize has legal constructs associated with the rights of parents to visit and rights of children to have access to their parents, that changing that idea to really being parenting time and time with your child, to really put that emphasis on this is your role as a parent and an opportunity for you to experience that role in very positive ways, and increased attention to monitoring the family's progress in those areas. And you'll see that in addition in this next slide as some discussion underway, and we think very exciting approaches in terms of shifting from phasing in family drug courts to really understanding the milestones of what needs to be demonstrated in the behavior changes in regard to the substance use, but also perhaps more importantly, the way in which those milestones of parenting and being able to recognize the needs of their children. We recognize that that often means that the parents themselves need to have that time to be able to experience their own nurturing in order to nurture their child, and really understanding the phasing of that in a milestone approach we think is very, very important. We also know that the universal assessment and referral protocols are great accomplishments in terms of changing practice and policy. We hear this a lot in jurisdictions that we work with, that they have a up and running family drug court, and yet they still need to go back and work through those communication protocols about how they have parents and families referred to them, how they record that in their information system so that they can monitor that over time, and what those referral protocols specify to ensure, we'll talk about in a minute, that need for a warm handoff between systems. We also know that some of those key mechanisms that have been put in place have been really changing some of the staffing structures. There's a lot of discussion in family drug courts about, should there be a unit of child welfare workers that are dedicated to that family drug court? Should there be co-located teams of the family drug court treatment and child welfare workers? How do you actually structure the way in which the staffing works across these systems? Gets into many of the supervision issues, the confidentiality issues. How do you do that teaming in a way that's most effective and efficient? The addition of a children's services coordinator, as I mentioned, just because you've added that service piece to your collaborative doesn't necessarily mean that it's a smooth going right away in terms of how the relationship, the communication, the referral process, the feedback loop, all of those things need to be worked through, and we recognize that the time commitment to work that through is something that the sites have needed to do. I mentioned the dedicated unit as well as different staffing patterns in terms of creating the family drug court liaison, so that not every caseworker has to be at court, or not every caseworker is the person that the team is relying on to get that communication, but how they've structured that liaison role, again, to really look at efficiencies in the way in which their family drug court is operating, and the way in which they're expanding the staffings and those sessions, again, focused on the effective communication to ensure that the progress for children, the progress in parenting, as well as the progress in substance abuse treatment is tended to in the family drug court sessions. Now, before I turn to the emphasis on the lessons with those examples of the accomplishments, many of you will find this slide very familiar. We've been talking about for some time the 5 R's and the evaluation data that have been generated that document that with these kinds of initiatives that emphasize access to treatment and monitoring, judicial oversight, that these sites have demonstrated many times over increases in recovery, increases in the number of children that are able to remain at home, the timely reunification of children, the lower recidivism of repeat maltreatment among these populations, and dramatic differences in the percentage of children that re-enter care after the family has participated in these kinds of initiatives of family drug courts. So you've heard the 5 R's. Now we're going to introduce the 5 C's. So we're getting through the alphabet soup, but we think is a way to help us really be focused on these lessons about collaboration, about the connections, the clarity of purpose and roles, the capacity of the sites of the family drug courts and the jurisdictions they're operating in, as well as the exciting cultural changes that are happening in these jurisdictions. So let me take a minute first in terms of the lessons of what we're learning about the collaboration itself. And I've mentioned some of this already, that the addition of new service partners in the parenting and the child development arena, again in particular, requires a step back and says, how are our other relationships? Do we have the right relationships and the right structures in place for all of the collaboration that's going on in our family drug court? When we add more partners, how it becomes more complex to ensure that everyone on the team is up to speed on the kinds of services they're providing, as well as the protocols for referral, how the information is going to be exchanged, that communication and the coordination. It doesn't just happen. That those are specific strategies that have to be attended to in order to really deal with the collaboration issues that are not just beyond, oh, go work with that provider, but getting specific, and they're helping us, the sites are helping us get more specific with the lessons of the protocols that need to be in place and how we can help additional sites really move through that process more expediently. We recognize that in each of these communities, there are other priorities that are going on in their community. Expansion of a family focus in the family drug court may not be their local board of supervisors' priority for their community. And how they deal with those other priorities and work with their local context of their current political situation, funding situation, the kinds of strategies that they're putting in place to ensure that that's happening is very important for us, and we recognize that they're well embarked in that. This is a quote from one of the jurisdictions about some of the challenges in terms of just even the communication and the coordination within children's services. Sometimes we think we know what's going to work best for them, but sometimes it really takes that specific strategy to meet with them and say, how does that work better for you? How do we change our practice? How do we ensure that practice change happens through a policy and a procedure, a protocol that makes sure that it's working when we have the whole family in our radar screen, if you will, about how we're ensuring services across all of those. Those connections, that means that the parents and the children that get those referrals to quality services, it's an ongoing challenge. We may have a partner at the table, if I dare say, that may not have all of the resources that they need to be implementing best practice in terms of treatment, in terms of parenting, in terms of the children's services. How do we make sure that the connections that we're making in the family drug court are to effective services, and to ensure that that communication, again, is happening, and who those providers are that can best support our particular families. From jurisdiction to jurisdiction, changes in what those family needs may be, and how to how to make those connections to those other service providers. So that mapping and the tracking of the community landscape, we have improved, we think, some of our tools in how to make that happen, so that we better understand that mapping process and making those connections easier for our future jurisdictions. Because if you build it, does that necessarily mean that parents are able to participate in it and that they'll actually come? So you see some quotes about some common, even though this is from a couple different participants in the site visits and the reporting. I think this is a generic issue across the nation, really. That disconnect that happens between the services that are intended and what parents or what children actually get. How do you ensure that that clear path and the obstacles are removed so that parents are actually engaged and that they're able to participate and their children are able to participate? Some of those complexities about when children are in foster placements, how do you do a parenting program in which children and the parents need to be together? Some real nitty-gritty, concrete operations about making sure that those key partners are involved. And sometimes those key partners may be the kinship placement or the foster placement that also needs this change in approach to say we're about the whole family and we're about ensuring that kids get the interventions that they need as well as the parents. So some real lessons in how do you make sure that once it's built, the barriers are removed, that families can participate. Part of that is about being clear. We can't emphasize enough the effort that it takes and the worthwhile nature that it is to be clear about the respective roles, the responsibilities, and the expectations across systems. We know that is key in a family drug court, that the participants know what those expectations are and they're clear about their obligations and their responsibilities and what they're accountable for. How do we ensure that there's clarity about the accountability across systems? Many of the sites are working with a children's services coordinator now. How do we ensure that everyone knows the role and responsibility about the children's services coordinator and how that relates to the child welfare case manager and how that relates to the children's program that may be implemented in the treatment provider? Again, that clarity of the roles and responsibilities goes hand in hand with the clarity of the communication that needs to be put in place. We've had a lot of lessons about the capacity for jurisdictions to implement evidence-based practices with fidelity and to integrate those as part of the core family drug court components. Those lessons in terms of the training, the staff, how you balance those competing demands, and then how you track and monitor across systems that the implementation of those evidence-based practices, again, is happening with fidelity and how we're looking at the capacity to do that in a way that increases the scale, meaning how many of the families who need that particular evidence-based program are actually able to get into the program based on the capacity of the jurisdiction to implement that. And we're monitoring that very closely in terms of the scale and the penetration rate and what that means with staff recruitment. I don't think that we have any sites that have not been challenged with some of the staffing and the training issues that go along with implementing evidence-based practice. And what we're calling cultural change, and really the excitement that I think we felt as the sites came together most recently about the culture of child welfare and treatment and court and parenting programs and children's interventions, to recognize that there's a difference in the way we respect and interact and communicate with parents and families that puts them at the center of our work. A culture change that may have already happened in the family drug court to move toward a less adversarial approach, that there is an effort to ensure that the family's well-being is at the center of their efforts. But that's a culture change not just within the family drug court team, but within the larger systems that are trying to support these kinds of efforts. It's interdependent in that if you have any one of these systems who's not an active participant in the family drug court, making that change happen so that there can be a larger system change within that community becomes even more difficult. But the excitement about that culture of being family focused probably needs to come first before we can see the rollout of those practice changes and the implementation of the protocol and the policy that's supporting that practice change to really be implemented. How many times have we seen a new policy roll out? And I hate to say that sometimes there's even an eye roll of here's the latest thing out of headquarters, if you will. And yet that implementation of the policy really needs to come with an understanding of what this means in practice to change the culture and how we're viewing families and keeping families together and allowing families to recover whenever they can. So that culture change is important. This was demonstrated with in one of the sites that a participant said that it used to be that we didn't really understand how they were going to really incorporate the kids' needs into the family drug court. I believe in this jurisdiction they were operating as a parallel court. How are they going to be able to address the needs of the kids and how they were going to fit that in without it having a big drag on our time? And a court that began to then say, we used to have this focus that the judge's time with the parent might be, you're doing a great job, you're showing up, your family coming to court, you're going to treatment, and how that change is now that it's about, we hear you're doing a good job, that you're an awesome parent, that you're attending the parenting, you're not just showing up, but that you're actually beginning to demonstrate the way in which you want to be able to be a mother. And that change is in focus for that particular family, but more important for that particular court and that particular jurisdiction. So that's the exciting part that we see in the Prevention and Family Recovery Program overall, that this culture change is really beginning to permeate within their team. And our effort is to really look at how do we ensure that that happens within the larger systems. With that, we're going to have another polling question. So of those 5 C's, we'd like for you to rate. What do you consider to be the priority area for perhaps change in your own family drug court? What do you most need? Again, we can't, Jonathan, yes, thank you, has launched that. We can't tell any individual person who responded in any one way. And so please do answer the questions, and we'll give you a few seconds to do that and make sure that we're getting that those answers back. Well, interesting, and I think in some ways somewhat not surprising. We recognize that the challenges that we've experienced and the foresights that we're working with in the need to be clear about the collaboration itself and the cross-system relationships. I wish we could say that we had a magic wand and that it happened across all of the family drug courts that are operating in the country, but we still have some work to do in that regard. And we're excited by the opportunities that we have both in the family drug court arena with prevention and family recovery, but we think also in the importance in how we look at the broader technical assistance program and ensuring that the leadership and sustainability efforts are in place in what we've learned in prevention and family recovery and how we're trying to take those lessons to the larger field. But with that, let me turn that over to Phil Breitenbuscher, who is the project director, who's going to spend some time about what we're learning in the leadership and sustainability arenas. Phil?
Yeah, thank you very much, Nancy. So interesting about and hearing your responses around collaboration and cultural change, because going back to our initial kind of understanding of this project, or our approach to this project, we talked about, or you heard from Nancy, that it was really around these three areas of parent services, child development and therapeutic services, and substance abuse treatment. But what lays at the center of all of that really is this idea of community collaboration and systems change and sustainability. In other words, it's that collaborative coming together to support all of these three types of services for the entire family. And what we recognize is that collaboration, that community system of change, really takes leadership. If you look at how we think about leadership in building relationships, prioritizing results, mobilizing resources, and they're also, that key effort of leadership is around the information flow. So they're the ones championing this effort. They're the ones championing the cultural change that's needed through building those relationships, showing them that the results will help in order to garner the resources needed to do this work. Part of the reasons why we think that the leadership arena is so important in this project is because and many times those leaders will bring people to the table so those collaboratives can be strengthened. So we won't get into too much today into the 3 R's because you've already heard about the 5 R's and the 5 C's. But if you think about leaders in terms of this key kind of yellow, the bridging of relationships, resources, and results. And I wanted to try to think about what are leaders and how can we assess the leadership levels of these sites and being so critical in understanding how these types of projects roll out, how you're able to implement large-scale programs like this, and how you're able to sustain them over time. We wanted to really look at the leadership qualities of these collaboratives and understanding that just to implement an evidence-based program in a single agency is very difficult in and of itself, and there's lots of research on how to do that best through implementation science and what it takes to do that. But what we've asked these family drug courts to do is take an evidence-based program or multiple evidence-based programs and then implement them in a collaborative, bringing together several partners, building the information sharing networks that's needed to do that, and then sometimes call on resources in other agencies, and then ask them at the same time to develop the necessary protocols and practices to create larger systems change. And I'll talk a little bit more about that. But what you need to be able to do that is to have leaders who are willing to champion this type of cause. And so when we talk about leadership domains, we looked at are these leaders capable of systems thinking? Are they innovative? Are they willing to be creative when barriers are presented to them? Are they collaborative? Are they willing to let other people and other agencies engage in the discussion, or do they tend to shut down discussion or ideas when those are brought up in the meetings? Do they become distributive? Are they avoiding change through a single agency? In other words, are they willing to think outside or work with multiple agencies, be inclusive? And are they outcomes focused? Are they data driven? Are they able to use data to drive decision making, both data at the local level and data kind of at the aggregate systems level? So those are the kind of domains that we were wanting to see in our leaders. To date, we've conducted over a dozen leadership interviews in talking to leaders, and what we mean by leaders is not just the judge, which we've done that, but also the coordinators. We've also looked at frontline leaders. So you have leaders at the team level who can think through these types of domains for their individual clients, and we have leaders at the middle management level, and we have leaders at kind of the executive levels who are able to continue to problem solve and to work with others. In addition to those interviews, we're looking at sustainability. Because at the onset of this project, we really went into this with thinking about that we've all seen grants that come and go, and when the grant goes, oftentimes the program goes with it, and that's a major disservice to not only the families and the children and parents that they were serving, but it's disservice to the staff and to the community organizations who put so much effort into developing these types of programs. So from the very onset of this project, we put sustainability at the forefront, and not just to sustain a program for sake of sustaining it, but for sustaining what really works, as you heard about that rapid cycle change, and to adapt programs and to be able to see what's going on a local level and keep what works and discard the rest. So we used a tool called the Program Sustainability Assessment Tool, or what we fondly call here as the PSAT. It looks at these multiple domains of strategic planning. And what we found is there are several strengths early on that we're seeing with these 4 grantees. We see that the grantees see that there's champions who exist, who strongly support the program, that they have leadership support from multiple levels and have strong community support. We also see that these communities are adapting to the new evidence base, to the new evidence really, and to seeing what works in their community. In some of these places there were existing parenting programs, as Nancy said. Some of them had already made connections to evidence-based parenting programs. However, when we went out there, when we looked at really the population that they were serving and tracked back to the evidence in which was that program matched up to the need of their community or to their population, these communities were able to adapt and to say, well, actually, no, it doesn't match, and we need to shift programs or match it to a different type of evidence-based program that better meets the needs of our particular population or to our community. And so there are also some challenges that we see over time, some organizational capacity challenges with staff time in wanting to come to meetings and attending trainings, understanding roles and responsibilities. As you bring on new partners, oftentimes now you're asking people to meet more often. You're bringing on folks that maybe haven't worked in a collaborative before, so that's unusual to them. We also then had to change responsibilities, and there were courts that had worked for long times with really one central coordinator or one person that was doing all things for all people. And now as we expand the scope of these family drug courts, those responsibilities had to be broken up into different places, and we're seeing that sometimes that's challenging in how you roll out these programs. And then even the short amount of time, succession planning becomes a big challenge for family drug courts and for these in particular, and seeing already turnover in key positions, and how do you plan for that? Program evaluation, although again, starting with very high-functioning family drug courts, as you bring on new partners, then you have to revisit the information sharing processes, and how do you share information across services. It's one thing to refer your clients to an evidence-based parenting program in the community, but how are you going to know your parents showed up? How do you know how they're doing in those programs? How do you know how can you get that information back to your family drug court staffings in a way that you can use it to make good case decisions? So those relationships, those protocols all had to be developed and worked out, and that's challenging. And the ability to use data, not just to send it off to an evaluator so that you can get a report 5 years down the road, but how do you use data in a day-to-day basis so that you can monitor the progress of your clients and of your program on a regular basis? So those are challenges that our sites are working through. Again, as we've talked about, we're adding in new partners, and sometimes adding in new partners means that we have to revisit turf issues. And things that certain people were doing in the past now have to be revisited and maybe shared, or partnerships have to be redefined. Program adaptability and funding, sustainability. So how do we build the infrastructure to support these practices? And the changing demands on the different systems. Part of those was, as Nancy discussed, and just the demand on getting children to these programs sometimes is a big constraint. But we've also seen in just, again, the short amount of time where we're seeing state and county budget cuts and sometimes an over-reliance in a lot of family drug courts on grants. We continue to focus and to be challenged with the small scale. It's difficult to garner public support for these programs. And if we're thinking about sustainability long term, it's hard to make the family drug court or these programs a priority for policymakers and for funders. And so how do we make it a priority for them? How do we get it to be a priority for their funding sources? And oftentimes that comes down to being a scale so that you're large enough to impact their outcomes. And it also becomes about that values and about how much do they value your program and these families. And so how do you build the relationships with those funders in a way that helps increase the priority of these programs and of these families? And then there's the larger contextual issues and challenges about other state initiatives that are coming down, as well as federal initiatives, and how well are we aligning our programs with those other types of initiatives, and are we out in front of that? in the leadership domains, we really look at leaders being able to cheer on or to celebrate the successes of their programs, and making sure that folks not only on the team are aware of the successes and that we're revisiting those successes, but we're also looking forward around potential barriers that may come our way, and how are we working through those larger contextual issues and challenges. So as we kind of look through those strengths and those challenges of these courts, and we've heard the early lessons, we thought there's a few key implementation lessons that we might want to share with you if you're thinking about adding on these types of components into your own family drug courts. And I think the first one that we would absolutely implore you to do is developing that governance and collaborative relationships, that structure that needs to oversee this change. I think that even in again, a single agency, if you looked at evidence-based science, you would see that there's a need for a core planning team. And when you're talking about family drug courts that are collaborative, implementing these larger systems changes, having a key leader, and a lot of times it's the judge who can convene these collaborative or this governance structure that's needed to oversee the change process, but they're going to need to instill upon these changes and the reasoning why this would be important. How do you begin to initiate that cultural change that's going to be needed to move from a parent kind of recovery program into a family services program or a family-centered treatment program? And how do you then begin to change the systems needed to do that work? How do you even select the services? This is a critical lesson learned in spending some time selecting the most appropriate evidence-based program for the families in your community. This starts with really understanding your own target population and who the participants are that you're serving in your programs, and then looking at what's available in your communities so that you're able to potentially partner up and use existing resources with those community services that are available, and or building the relationships with those partners so that you can either prioritize your families or help them to maybe think about shifting their program or adopting a practice that might be more suitable for your community. And then once you build those relationships or to select on those services, there's that need for information sharing, as I spoke about earlier, and building those databases, those protocols, those communication protocols for sharing information across systems and for tracking the information, not only how are parents doing, but in data aggregate form so that you're able to talk about how well parents are doing and how well your program is doing compared to larger systems, so that you're then able to work into sustainability efforts and to understand who might be willing to fund these types of programs in the long run, who are your best bets, and what types of data do they need to see to be willing to pick up the cost of these programs. What barriers are you seeing that you can help them overcome, or that they might be able to help you overcome in your own programs, and what are the outcomes needed to identify those sustainability resources. I think we'll end with these, is that it's important to recognize that effective parenting and children's services or interventions are linked to timely and effective substance abuse treatment. Again, even though we selected sites that had very high functioning family drug courts that had built relationships with treatment providers, that the key to all of these other things happening is that substance abuse is effective. And if you're a family drug court who does not go and visit your treatment providers on a regular basis or ask them about the treatment that they're providing, we strongly recommend that you do that on a regular basis, and that you know that they're providing evidence-based, curriculum-based treatment, and that it matches to the population that you're sending to them. And then the challenge of tackling this idea of systems change while you're making evidence-based enhancements with fidelity is difficult and complex work. But we're seeing through the 5 C's that it can be done. And in fact, now we've come to the conclusion that really you can't implement evidence-based programs in your family drug courts without tackling systems change. And systems change oftentimes comes because you're showing better outcomes and you're able to connect to research-based programming. So they really do go hand in hand, and although it's difficult, it's really the direction in which we're headed to. So let me just end real quick with this. We're going to move to some question and answers, but We want to, again, make sure you have this website. You can learn more about our National Advisory Council members, our staff, and our evaluation design at our website, which is there. You can also contact any of us directly with our contact information here. The easiest place to start might be at pfr@cffutures.org. And now I think we're going to move into some questions. And there's been a few that were submitted that we want to start with. So let's see here. I think the first one, Rosemary and Phil, I'm going to throw to you. How can we get our local foundations interested in supporting this kind of initiative? Phil or Rosemary, would one of you be willing to tackle this one?
Yeah, this is Rosemary. I think one of the issues is really to demonstrate the cost of not serving these families well. I think the Doris Duke Foundation became interested in looking at the substance use issue, first of all, because it's so prominent among the cases of families that are referred to child welfare, that we know that neglect is the most common form of maltreatment, that triggers an investigation or an assessment of a family, and that in many, many cases substance use is present. And so looking at the high cost of foster care, the high cost of the multiple issues associated with substance use, we're looking for effective evidence-based interventions and trying to take a holistic approach to dealing with the entire family rather than segregating treatment programs for a child or treatment programs for an adult. I think is something that can capture the imagination of many funders.
Okay. Thank you. Rosemary. Phil, did you have anything that you wanted to add to that?
Yeah, I think Rosemary is absolutely correct. And from a practical standpoint, working through your state network of grant makers or trying to perhaps do a presentation at an annual conference of your network of grant makers or something like that would be one way to begin to build a base of information that all the funders would have. I know, for example, that we're happy to make a presentation or have a telephone conversation with any local funder in terms of sharing our experiences about this project and what we've learned and why we were interested in it. And then very often national funders are looking for local and regional funders to help leverage their dollars on projects like this. So if there's national interest, it can go a long way towards spurring local funders who want to see their dollars go further, and being able to use some of that to match national money is often an attractive feature for local foundations.
Great. Thank you very much. We also had a question. I think I'm going to direct this one to Nancy. The question's asked, if leadership is so important, where can you or do you find them, I guess leaders, and who typically provides the leadership of these types of initiatives?
Well, it's always been very interesting to me as I've had the opportunity to travel around and visit family drug courts that often it's, or I should say that it varies so much in terms of who's really providing the leadership to get a family drug court started, who keeps it going in the tough times. We've seen jurisdictions that the family drug court coordinator becomes the leader that is able to work with the local policymakers in a way that demonstrates the successes and often needs to be able to demonstrate the cost savings to that jurisdiction, the county or the region, that gets leadership in tough times to continue to support. We've seen jurisdictions in which the judge is really the leader that's calling that together and making sure that there's the will to keep going or to get something started. But we've seen that also come from child welfare agencies or from treatment agencies. I think it's exciting when we see caseworkers that have been able to say, we need to do something different. We're not getting good results. In very early efforts to document what was going on in family drug courts, it was so exciting to ask parents' attorneys, why are you doing this? Why are you taking a leadership role in your jurisdiction to create change? And they said over and over, because we see change, because we see parents getting access to services for the first time, sometimes in their career, working in a dependency court system, that we're seeing an increase in reunifications and families having the opportunity to be well. And that's an exciting thing to think about that across all of these jurisdictions. Does it take only one leader in a jurisdiction? That's really tough to say. It's really that leader building the partnership across systems, and we know that strong leaders are really those that are able to give the responsibility and the authority for making change to those that are sometimes those that report to them. That strong leadership builds that team within their system and across their system so that those that are not the top person in the organization have the ability to work together in new ways, and they provide the direction and the ability for them to work, but that it's that layer that's not necessarily that top person in the jurisdiction that is the leader or has the leadership to make these kinds of changes that take this collaboration across systems. Phil, anything that you would add to that?
Yeah, I'll just add real quickly that, I think that what we're seeing with, highly functioning family drug courts is that it's built with a team of leaders, and that we see that the parent attorney becomes a leader among their peers and on the team, and that they're able to really fight for what's right for parents on these teams, but in a way that's respectful and helps hold the other systems accountable. We see that the judge is a leader, and that they're able to advocate for what's needed. And so this whole idea that it's I think of what Nancy just said, this idea that it's not always just one leader, it's many times a team of leaders all the way down to the social worker or line level folks that are really able to advocate and to collaborate and to be innovative and to be creative. It's really helpful for these teams. So just real quickly, there was one last question, and we're just about out of time, but whenever someone asks a finance question, I think it's worth trying to address. And somebody asked, how those sites that have children's services coordinators, how are they funded? And for the most part, for this particular set of grantees, many chose to use these grant dollars to fund that position. However, what we've seen in other courts is that that many times can be funded by the Child Welfare Agency. Sometimes it's funded by the court system, and other times it's funded by another community-based organization. But a very good question, and there were also many other questions that came in that we didn't have time to address, but we will address each of them on the Family Drug Court blog. Let me just end with a couple of notes here. I would like you to think about saving the dates for our last two webinars coming up for this year, August 13th and September 10th. And our next one will be in August. We're taking the month of July off because most of us will be at the National Drug Court Conference. And if you're attending that, you should see a Children and Families program coming out through our agency, which will highlight for you all of the children and families and the family drug court sessions that's happening throughout the National Drug Court Conference. But our next webinar is on Thursday, August 13th. Please save the date. The registration for this session should be open soon. This will be highlighting our peer learning court program, which now has 9 kind of model or mentor courts across the country. We're going to use a TED Talk type of format for that, and we're really looking for you to interact with these peer learning courts and introduce that program to you. And as I spoke about earlier, please visit our blog. It highlights our peer learning courts, our podcasts, leadership resources, videos, and future webinar registration. So there it is, familydrugcourts.blogspot.com. We welcome you to attend that and to visit that. So let me end by first of all thanking our speakers, Dr. Nancy Young, and of course our funders, Rosemary Chalk and Phil Redmond. Thank you very much for your assistance and support of this program. And thank you to all of you for participating in today's webinar. We really appreciate your time and your commitment to children and families. At the conclusion of this webinar, you will be redirected to an evaluation. We really appreciate your feedback as that we try to incorporate your thoughts in our upcoming webinars. So again, thanks to everyone for your time today, and that will conclude today's webinar. Bye for now.